The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.
Welcome to this ASCO in Action podcast, brought to you by the ASCO Podcast Network. This is a collection of 9 programs covering a range of educational and scientific content and offering an enriching insight into the world of cancer care. You can find all of the shows, including this one, at podcast.asco.org. The ASCO in Action podcast is ASCO's podcast series where we explore the policy and practice issues that impact oncologists, the entire cancer care delivery team, and the individuals we care for, people with cancer. My name is Dr. Clifford Hudis, and I am the CEO of ASCO, as well as the host of the ASCO in Action podcast series. For today's podcast, I want to share with everybody a preview of the 2020 ASCO Advocacy Summit and Week of Action taking place September 14th through 18th, 2020. Now, typically, ASCO gathers our volunteer advocates in Washington, D.C. in September for educational sessions and in-person meetings with their respective members of Congress. But of course, due to COVID-19, so many events have had to be scheduled virtually or take place in an altered fashion this year, and the 2020 ASCO Advocacy Summit is no exception. It will be a virtual event, but participants can still expect the same advocacy and educational activities that the event provides every other year. ASCO volunteers will meet with their members of Congress and their staff. They'll just do it by phone or video. And they will still advocate for the policies that we seek that will improve access to high-quality, equitable care for people with cancer and that ensure robust funding for the entire cancer research enterprise. Advocacy Summit attendees will also attend webinars to receive training and education on how to lobby in Congress and on the current political landscape. What is very different this year is our online Week of Action. This will give all ASCO members, not just those who are participating in the meetings, but all members, an opportunity to advocate on critical issues of great importance to the entire cancer care delivery system in the United States. Participants in the Week of Action will have the opportunity to amplify the messages brought by those who are participating in the Advocacy Summit. They will do it through email and social media messages to members of Congress using ASCO's ACT network. And I want to make it clear to everybody how easy it is to get involved and make your voice heard. All you have to do is click on the link to the ACT network, and you'll find that link in the Advocacy Center on asco.org. If you do that, you'll sign up and then receive ASCO ACT network emails. Once that happens, you will get all the information you need on the fastest and easiest ways to contact lawmakers directly. And that will come right to your inbox and will allow you to take action that makes a difference. We hope you will participate as much as you can. This effort just takes a few minutes, and even one message a day by every ASCO member could have a transformative impact on your representatives in Congress. I will share with you, I do it all the time. Every time I get an incoming email from the ASCO ACT network, I take a moment and I customize the message and I send it on to my representative or my senator. I hope you'll do this too. Now, during the 2020 Virtual Advocacy Summit, which will be held in the middle of this Week of Action I just described, it will specifically be September 16th, ASCO volunteer advocates will have their virtual meetings with members of Congress and their staff. The 3 issues or legislative asks that they will be discussing at these meetings will be the same asks that ASCO members will contact their members of Congress about during this Week of Action. So our messages will be aligned and reinforcing. The first of the 3 is that we will be asking Congress to support legislation, the Clinical Treatment Act, which will give all Medicaid beneficiaries coverage of routine costs when enrolled in clinical trials. This is coverage that Medicare and private insurance plans already provide. This brings to parity the coverage that Medicaid participants receive. The importance of improving health equity has, if anything, been heightened and made more apparent during the current COVID-19 pandemic. This legislation takes us one step closer to that long-standing and important goal. The second of our three asks from ASCO volunteer advocates is for support from lawmakers and co-sponsorship of the Safe Step Act. This is aimed at protecting patients from the potentially harmful impact of step therapy protocols. Step therapy is something that ASCO believes is never appropriate in the treatment of cancer, and this is an important act to try to prevent that from causing harm to our patients. Finally, the third of our three asks addresses the impact of COVID-19 on cancer practices and on cancer research. Specifically, our advocates will be asking Congress to endorse the maintenance of reimbursement flexibilities for telehealth, as many oncology practices have rapidly transitioned to this mode, telehealth, to ensure patients receive continued treatment and support throughout the pandemic. To that end, we will be asking Congress to provide emergency funding to the National Institutes of Health to mitigate disruptions to labs and clinical trials also caused by COVID-19, and to help restart badly needed and now lagging research across the country. So these three issues are the same ones that participants in the Week of Action will be advocating all week long through their outreach to Congress, as I described before. So you can see the big picture now. In virtual person, we will be asking for these three areas of support, and then across social media and email, all of you hopefully will be echoing and supporting the same message so that we build a clear message of support and uniformity in our asks to Congress. Now, the goals of the Advocacy Summit and the Week of Action are to advance these areas of concern, to advance our priority legislation, to amplify the collective voice of the entire cancer care community on Capitol Hill, and to help get ASCO members involved in advocacy initiatives, and I dare say, provide a means for people to be involved. We know how passionate, devoted, dedicated so many of you are, and we know you're looking for a way to support the cause. This is it. Members of Congress and their staff have grown accustomed to virtual constituent meetings over the last few months, and personal stories continue to be the most effective form of advocacy. So the Advocacy Summit and the Week of Action, even conducted virtually, remain critical to ASCO's larger advocacy efforts. It is these personal contacts that make all the difference. In addition to the meetings and the messages between advocates and lawmakers, the ASCO Advocate of the Year and the Congressional Champion for Cancer Care will also be named and announced during the Advocacy Summit. I'm not going to share those names now. This is something you can look forward to hearing about during the week itself. I hope you'll tune in and pay attention to learn who these wonderful people are. So as I close today, one last time, I want to encourage everybody who's listening to follow the Advocacy Summit through social media using the hashtag ASCO Advocacy Summit, and that'll be used on Twitter, and to participate in the Week of Action, as I described before, through the ACT Network. I'll remind you that there's a link to the ACT Network and all of the information you need to participate in the Week of Action at asco.org/ASCOAction. And until next time, I want to thank you for listening to this ASCO in Action podcast. I'll remind you that if you enjoyed what you've heard today, don't forget to give us a rating or review on Apple Podcasts or wherever you listen. And while you're there, Take a moment and subscribe so you never miss an episode. The ASCO in Action podcast is just one of ASCO's many podcasts, and you can find all of our shows at podcast.asco.org.